So we'll just get started. For those who don't know me, my name is Jacquelyn Legere. I'm the Director of the Human Research Protection Program here at Horizon. And what that entails is having essentially compliance oversight of all the research projects that are conducted throughout Horizon. I'm going to be co-presenting today with my colleague, Dr. Donaldo Canales. Donaldo is going to walk you through some of the actual platform itself, and so you get a visualization of what it looks like as an app from the applicant perspective, how to navigate through your research study submissions, and then sort of you'll be able to have a snapshot of all your research projects within the system once we're fully operational. Before I get into the specifics of Infonetica, I just wanted to go over a couple of housekeeping items. So for this session, because it's intended to actually be interactive. So if you have any questions throughout, feel free to raise your hand. You can put them in the chat or just, chime in and unmute yourself, because you may see something that you want to comment on or have further information on and at the time that you see it. So please do just let us know. We're recording it, as I mentioned, so that people can go back and revisit if you happen to miss something that you want to take a closer look at. And just a reminder that this session is part of the RQM sessions that are held the last Thursday of the month from 12 to 1. And there are a number of different research topics that are covered throughout the hour. So feel free to bookmark this in your calendar or reach out to Stella. Stella will put her email address in the chat so you can reach out to her and get a listing of the topics that are upcoming throughout the year. Yeah, so I'm going to launch right now to Infonetica. I don't have any slides just because my portion is relatively short, and I just wanted to cover essentially how we got here. So how did we end up with Infonetica? The conversation essentially started about 2 years ago, looking at different platforms, actually re-engaging with our current vendor, who is ROMEO, to say, is there any more flexibility that can be built within the system? Any sort of revisions that can be made, because we're having challenges not only on our user end, it's really not intuitive, its accessibility can be challenging at times, but also with respect to reporting. So that was one of our biggest challenges, trying to do strategic planning when you don't have a really good grasp on what your numbers are, especially with respect to research participants, different types of principal investigators attached to their various therapeutic areas. It's really challenging to get that information out of the current system. So, we're doing our best, and Stephanie, who's on the call, will tell you, who's responsible for reporting from the ROMEO system, kind of makes a face like, oh, I need to do a report within 24 hours. How am I going to do this? Because it requires a lot of querying of the system currently, a lot of data cleaning. So we were looking for different vendors. So I happened to have a conversation with this company. Infonetica is based out of the UK. There are a number of Canadian institutions that already use them, hospital systems, academic centers, who are already on the Infonetica platform, as well as some of you. I'm not sure if you're familiar with the Can Review Streamline Research Ethics Review System, that initiative that's happening now. They're also using CTO Stream, it's called, which is essentially Infonetica. They're using the Infonetica system. So it's quite flexible. It has the capacity to be configured the way we need it to be configured. So ROMEO was essentially out of the box, plunk it in, make a few changes, and off you go. Infonetica is being designed essentially from the ground up, tailored to what our Horizon research community needs and what the researchers or the research reviewers, the REB as well as the ORS component, requires to do our competent and essential reviews. So essentially that's it in a nutshell. I'm going to hand it over now to Donaldo, and if there's any questions on how we got here, but it's essentially been a 2-year journey with the implementation and building the system starting in the summertime with our team, which is Donaldo, Stephanie, and Tricia from the Research Ethics Board. So many thanks to them for all the hours that they put in our multiple meetings with Infonetica over the last few months to build you a system actually that's going to be better for the customer perspective, but also on the back end for us for reporting and strategic planning, especially now we're one of the the 4 pillars in the new strategic plan. It certainly puts some more emphasis on how important it is to do proper planning and foreshadowing for what's required for our communities. If there's no questions, I'm going to hand it over now to Donaldo, who's going to log into the system and give you a look.
Great. Thank you, Jacquelyn. Good afternoon, everybody. It's nice to see everybody online. A lot of familiar faces and familiar names I haven't seen in a long time. So it's nice to see everybody. So what my portion will be is I will actually take you through Infonetica. I'll show you the login process. I'll show you what it looks like. We'll go through the form. I will start filling out the form like an applicant, although for my role, I will mostly be on the back end. And so I want you to keep in mind that when we go through all the different aspects of Infonetica, it's very much like you're walking into a house that's still under construction. So there's a couple of things here and there that are, loose ends. Some of the formatting needs to be tweaked. But for the most part, the structure is there. So you may see a couple of things every now and then that probably look a little not quite right. All that will be cleaned up as much as possible before the launch. And yeah, so it would be most beneficial, I think, we think from your perspective, to be able to see the program and see how it works. So everybody can hear me and see me okay? Yeah, couple nods, great. Let me just share my screen. So this is the Infonetica landing page. So, when you type in Infonetica, this is what will come up. I've been told that the way the migration, when the migration happens, what will happen, from what I've been told, is all the users will be imported into the system. And when it's your first time to log into Infonetica, you will log into the forgot your password option. So you forgot your password, you type in your email address, it'll send you the reset link, and then you can go in the system and change your password. So I will log in. Yeah, my password's correct. All right. So so again, I'm going in as an applicant. So this will be what you will see when you log in. So this is the work area. I can expand this out a little bit. So the work area is the first page that you will see when you log in. As you can see right here, I have a couple of studies that I've just kind of been playing around with. None of these are real, obviously. I'm just playing around with the system, trying to understand it. So here you will see all your studies ordered, listed. You'll be able to search for your studies. Example. You'll be able to create folders to group studies if you want. You'll be able to delete folders, delete projects, duplicate projects. You can move studies like this, probably pop them into folders. I haven't quite played around with that yet, but I've been told that is the case. At the top here, what you see are different tiles. These are basically, they're a series of notifications. So any single time that there's something new with your study, probably some feedback that's coming back to you will appear as notifications. So if I click that, you'll be able to see some of the notifications, and then you can mark them as read. You can adjust how many notifications you see per page. You can search for them. If signatures are required, you will see them here. Signatures for PIs. And these two tiles for transfers and shared, you will be able to share your project with other team members if that is the case. And the transfer tile would be when you are, I was told by Infonetica, will be when you are transferring ownership of a project to somebody else. So you'll be able to transfer projects and share your projects with other people. And when you share projects, the person that you are sharing it to, you'd be able to set their permissions. This tile, this navigation pane on the left just kind of mirrors some of this. The work areas is the page that we are on. You'd be able to look at your projects, contacts, if you have any, signatures, if anything is required, and the transfers. As you can see, there's nothing at the moment. So that is the landing page in a nutshell. Up here on the right side, you'd have your profile related information, other notifications, and so on. So let's go in and create a project. So I'm Dr. So-and-so, starting a new project from the ground up. So you go create a project. So what you will be asked to do is you'll be asked to give your project a short title. So let's do that. Let me see. It's a good title. There we go. You will select the form and you create it. So project created successfully. So this page here is now your project overview. On the right hand side, there will be some information about your study, the short project title, the project ID. So this will be this will form the basis of the study ID. We are doing the Horizon RAB form. You can see it's not submitted, and a couple other bits of information. And you can also expand and remove this. Here in the center, you will have your project tree. You can collapse this if you want. At the top will be the name of the study, and you can see that underneath that we are working on the main Horizon RAB form. When you start making amendments, when you start adding extra forms like notifications, protocol deviations, study closure, all that stuff, all that will appear underneath just listed underneath. This right here is the RAB form. So it's broken up into two sections, into two different parts. On the left is the section. So those are the main sections of the form. And on the right, we have all these extra tiles. So all of these are effectively, they kind of work like pages within the section. So you can see here for procedures, there's 4 main pages under procedures. And within those pages, there are questions. At the top here is, at the top here is the submit button, the completeness check. So you can click that and it'll tell you what needs to be completed. I haven't filled anything out, so everything needs to be completed. We'll have here the list of all the other subforms, which I'll get to in a bit. And you'll have more information. So you'll be able to view it as a PDF. If there's changes to the form that we push out, you just hit refresh and the application will refresh. You can share it. This is just the project tree. So one thing you will notice right off the bat is that some of these sections here are grayed out. And that is because some of the sections are only activated depending on the types of questions that you answer. So for example, research staff and co-investigator are grayed out because we haven't told the form that we have research staff and co-investigator. When we indicate that, under this section, under this page, these will become active. In addition, one challenge that we had with ROMEO was that ROMEO was is, because we still have it, ROMEO is very clinical trial centric. A lot of the questions are heavily focused on clinical trials. So if you're doing a non-clinical trial, a lot of the questions don't really apply to you or don't really make sense. And because of that, what we decided to do is we decided to take all these questions that are highly specific to clinical trials and put them in their own section down here. So if your study is not a clinical trial, none of these pages will be activated. So you can just skip them, and you don't have to worry about answering questions about your clinical trial when you're not doing a clinical trial. So that is some of the efforts that we've been putting into streamline the application as much as possible. So let's go into the first section here. The first section at the top is referred to as screening. So this came out of several conversations between ourselves, ORS and the RAB, and we decided that there are very high-level bits of information that we need to know, that we would like to know about your study right off the bat. Sometimes we are reviewing studies, and when we're like halfway through the review, we're like, oh, okay, it's actually a quality improvement project. I had no idea. So like sometimes there's different types of information that we just need to know at the start to help frame, guide us or frame how we view the study. So all those questions are under screening. So we'll go into the first one. So this is the first page. Consists of all the screening questions. We'll go through some of them. To go back, you can hit that navigate button and it'll just take you back to the main page. So submission type, you're filling out some questions, you're like, what section am I on? I forget. You can go back. So for example, the first question, is this submission a clinical trial? That's a very important piece of information that we and the RAB like to know. So if you click it, you get this message. If you click no, you get a slightly different message. So if we click yes, you get this message that says, based on your response, the application will proceed to full board review. The RAB may adjust this. If you click no, it's not a clinical trial, your application will proceed to delegated review, and the RAB can adjust that. I'm going to click yes for right now and navigate back out. And as you can see, the clinical trials pages have been activated. If I go back here, click no, you can see they are grayed out. So if I'm doing an observational study, quality improvement study, or registry, well, some types of registries, not all, but you can see that these questions will not be asked because they are not relevant. So we'll keep it as yes, it's a clinical trial for right now. Oh, one thing up here is this little bubble. So what you can do is you can click that as you're filling out the application and add comments to yourself, or perhaps two of you are working on the file, you can add comments to each other to help guide your application. Please indicate the study type. That is another very important piece of information that we like to know. So it's a clinical trial. Let's go sponsor initiated. Is the primary purpose of this submission solely for advertising a Horizon facility? So sometimes we get studies that have approval elsewhere and their only sole purpose of applying to the HRPP is to advertise within our facilities. And we like to know that because it just frames how we approach our reviews. So they can indicate yes or no. Is your study happening at one site? Is your study approved at one site and you want to expand it to another, which is another piece of information that we like to know. So let's say yes. You provide that HRPP REB number. We also like to know if studies are case reports or a case series. whether the study is a registry, database, or biobank. Let's go yes. Let's throw no here. Is the submission a quality improvement initiative? You have some guidance text right here. If you click yes, you're instructed to fill out the screening tool and upload that report. Click no, because it's not a QI project, that disappears. So let's say it is. Is the submission a trainee-led project? So theses, RIM projects, residency projects, or a project primarily led by a trainee? If you hit no, life goes on. If you hit yes, you're notified that if it's a trainee-led project, the trainee must be listed as the primary investigator. So as you can see, the form is adaptive. It just goes based on what your responses are. So we've built in a lot of these dependencies, a lot of the branching logic within the form. Whenever you hit next or previous, it will automatically save your form. So those are all the screening questions. Let's go now to the next section, which is the project details. Let's go back to the main form for 1 second. You can see down here that the signature and declarations section is grayed out. I believe, oops. I believe that may be tied to the project details. Oh, no, it's not. Oh, wait, it might be, yes. Sorry, I'm still trying to work my way around this. So you are the principal investigator and you will sign the declaration to see if that makes any changes there. It does, it activates it. You are the PI, so you'd have to sign. You are not the PI, you are filling the form out on their behalf. Let's go back, signature and declarations, you have to request the PI signature. So let's say you're the PI. The project title here you can indicate the full study title, start dates and end dates. Some of this will look familiar to all of you who are familiar with ROMEO. Principal investigator, you will include all that information. We're still tweaking some of these options, or you'd be able to load. So it's nobody here at the moment, but I presume there'll be a list of people, and if they're on your team, you can just add them. So one problem that we've been having with ROMEO is that often applications are submitted and they don't have CVs or they don't have TCPS2 training certificates attached. So here they are embedded within the form for you to upload them. And these are required questions, so you will not be able to submit your form unless these documents are uploaded. You review the HRPP SOPs, yes. Is the primary investigator a physician? Say it's not a physician, life goes on. If they are a physician, you have to upload the medical license. So all that is built within the form. Will your study involve any of the following? As you recall, if I navigate back to the main page here, these two tiles are grayed out. So if I go back into it and if I indicate yes and yes, you go back, you can see they are now activated. So one pain point for ROMEO is that we typically don't know who to send emails out to. Sometimes we send notification emails out to too many people, sometimes not enough people. Sometimes one team wants it to this person and another team wants it to that person, and we just can't keep track of all of this. We can't figure this out. So one change that we made with Infonetica is that everybody who was added to the file, regardless of whether you are a PI, a co-investigator, or a research staff, if you are added to the file, you will receive all study-related communications. So everything will go to you. So that is a major change that's happening. Let's go to the next page for co-investigators or research staff. So you'll be able to add research staff. Currently in ROMEO, I think you can indicate principal investigator, co-investigator, and after that, there's like research assistant, research staff, research manager, research coordinator, research this, research that. We've done away with all that. So now it's just research staff. All those minor distinctions don't matter from our perspective when we were doing our reviews. So you'd indicate the research staff, you'd load their profile if the profile's in the system, and you can always go ahead and add another. So a lot of these are repeatable. So I'm not going to go through the whole form, but I want to go through a couple other sections. Let's try this one. So you'll be able to, some of these questions have been taken straight out of ROMEO. You indicate the protocol number, the protocol version date, and you can see right here, the protocol is not added at the end like it is with ROMEO. It is added at the appropriate section within the form itself. You notice that some of these questions have little icons at the top here. So I encourage you when filling out the form to always check the icons. All documents, consent forms, blah, 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 must be uploaded. Yeah. And we have a link to our protocol templates here. So check the help icons whenever you can. I tried my best to go through the help icons, and whatever I thought was relevant, we ended up putting it underneath the question as guidance text. So it's kind of hit and miss right now, but for the most part, it will appear under the question. Brand new, this is a brand new question for we have several brand new questions that we've added. So were any of the sections of the application written in whole or in part with assistance of an AI application? This is happening now. This is a new trend. So we've decided to ask information about this. If you indicate yes, you will have to describe how the application was used. We'll go out to navigate. Let's try another one here. Are you seeking waiver of consent for secondary use of identifiable information? So this is the waiver of consent question. If you hit no, you ride off into the sunset and live happily ever after. If you hit yes, you now have to address all the points under TCPS2 Article 5.5 or 12.3. The REBE has recently requested clearer information for criterion E. There was an email that went out about this a couple months ago, or last month or so. So now we've included that here as guidance text. Does your study involve obtaining informed consent? Most of you will indicate yes to that. We have here our templates which are linked out, and if you hit yes, you can upload the consent forms right in this section. So the form proceeds in this manner. Here are some of the clinical trials related questions. So let's go to trial procedures, for example. Some of these questions are straight up from the ROMEO form. They haven't changed. Placebo-controlled study. Is there an independent safety data monitoring board? You hit yes, no. Let's indicate your responses to all the questions. And okay, so what we did with Infonetica is we tried to embed forms, the uploading of the documents within the form itself whenever possible. Everything else that we felt didn't fit within the form are now in this upload section. So these are the leftover options. Some of you may recognize these from ROMEO. So here you would indicate whatever else you need to add to the form. So let's say a CRF. You can see here we have a spot to upload that. Let's say an interview guide, spot to upload that. Variable code book, upload that here, or maybe none of them apply. Or maybe you have another. And you can, and all these, you should be able to upload multiple. So if you have more than one CRF, you should be able to upload multiple versions of it. All right, so you have filled out all your information and you go to submit the form. You submit the form here. Submit, it's telling you you didn't fill out all these sections, but since I'm in beta mode, I'm able to submit anyways. So you get this notification here that your application has been submitted, and I got just right now a corresponding notification to my email. Now, when I go back into the form, you will see that the form is locked. It cannot be modified. All the questions have been grayed out. So you can't click on anything because it is now under review. So then the question becomes, how do you submit an amendment? So this is perhaps one of the biggest changes with Infonetica. Currently in ROMEO, you submit your form, it undergoes review, it gets approved, but the main form is locked. It's locked forever until the end of time. If you want to make an amendment, you have to go and select an amendment form and then submit the amendment as an event. And then that event gets approved by the REB. But the form stays the same. And you can imagine that this is a problem. Imagine that you've been running a study for like 5-6 years and there's been many amendments, changes to the methodology, changes to the focus of the study. All that information on the main form in ROMEO would stay static and never changes. And so that can be problematic because the information is just outdated. Even one single significant amendment can change the nature of your study. So the way that Infonetica handles amendments is, you can't see it at the moment because it's being built, but on this row of buttons, there will be an extra button that says unlock for amendment. So you'd click that button and the form will become unlocked. And then you can go throughout the form, add new documents. If you need to add new documents, make changes to the form itself. And then when you're done with all those changes, you would submit it. And then it comes to us as an amendment. And then from our side, the reviewer side, Infonetica has tools built in where we can see what all the changes have been made. We can see what changes, what wording, what options have been changed. We can see what has been added. We can see what has been deleted. So there's a lot of transparency with that. And when you are in this form, or like when you are in the amendment, when you're doing the amendment function, you cannot, you can cancel it, but you can only exit out of it through submission. So you can't like unlock it, make a change, and then like save it, and then back out of it, and then nobody will ever know about it. I think the only way that you can exit out of that is to either cancel the changes altogether or submit it. And then that would come directly to us. And the other beautiful thing that Infonetica does is the initial form will be saved as a version. When you make an amendment, you will get version 2 of the form. When you make a third amendment, you'll get version 3 of the form, and so on and so forth. So by the time you have 10 versions of the form, each representing a different amendment, you can actually click on all those different versions and you can look back. You can see what your form was like back for amendment number 3, for example, if you are currently on amendment number 10. So it stores histories, it stores snapshots of the form at different times. So that's how amendments are handled. They are handled by unlocking the form and making changes directly to the form, submitting that, and all those changes are logged. The other thing that I wanted to walk you through are the subforms. I won't walk you through all of them, but all the subforms are created here. So these are your notifications to the REB. These are the protocol deviations, annual reapprovals. All that is housed under create a subform. So here's the list of the new subforms. Some of these will look familiar. Annual reapproval, local and anticipated problem, protocol deviation, study closure. The notifications to the REB are now split between a major administrative change and a minor administrative change. And some of the previous forms, like for example, the non-local and anticipated problem, that is now housed within the major administrative changes. So let's go through one. Let's look at the minors. You can see here in the project tree, this is now housed in the project tree under the main form. And this is what it looks like. So this is still very much in progress. There's some changes that need to be made. Each submission, the first page will be some guidance text as to what this form should be used for. And you can see all these sections are grayed out. So let's go in and do communication DMC and some auditing, some audit and monitoring report. So let's say we want to, some of this text will change. We're still tweaking some of this, but this will be communication materials to the participants, DMC report, and audit and monitoring report. Now, if I navigate back, you can see these corresponding sections have been activated. So a little blurb about what the purpose of the submission is, and then you upload the document. Go to the next one. Audit and monitoring report. Actually, you can see there's not much information here. This is still under construction. You upload the report and so on. So all that is handled. All these things are handled within the minor administrative changes. And we also have an option for other. Let's go back out. So right now we are in the minor administrative changes to the REB. Let's go back to the main form. As you can see, like I can't access any of the other subforms. So I'm going back to the main one and I can create another subform. Let's try a protocol deviation. Again, you can see it's stored underneath in the project tree. Submission details. So we have some guidance text as to what is required for this form. And a lot of these questions are pretty much mostly the same. Type of deviation, you indicate. Lots of deviations here. It's not a good thing. Does this deviation event involve more than one participant? You click yes, now you get a warning here. This form will now be regarded as a major deviation protocol based on what the REB wanted. So that is the deviation form. Then you fill out the rest of the questions, sign off, and hit submit. Let's go back to the main form. And we shall wait for these things to load. Create a subform. Let's look at one more. Let's look at the annual reapproval. Again, the annual reapproval is underneath in the project tree. All the amendments will appear here as well. So the annual reapproval form, is probably one of the more lengthier forms, because we need to get a lot of information about participant accrual numbers, completion numbers, totals, all that sort of information. So all that information historically has been very inconsistent, very difficult to get reliably. So we've included, we've refined this a lot more with some more guidance for reporting numbers. So a lot of this is very much the same from ROMEO. You can indicate the recruitment status of the study. The help text up here, so you know what all of those mean. And here you start reporting some accrual numbers. We have lots of text here, lots of guidance, guiding you as to how to report these numbers. And these are all the numbers that we kindly ask you to report. It's all broken down by different phases of the study. Each one has guidance text. And I asked Infonetica to label all these. So for example, so this page here refers to accrual numbers. AN 1 to 5 are universal, and AN 6 to 7 are optional. By optional, we mean that they only apply if it's a clinical trial. So let's say you're filling out this form and you're like, oh no, I don't know how to fill out this form. I'm confused. What exactly is AN2? You can reach out to me and you can refer to this specific question. Hey, Donaldo, I'm having troubles. Question AN2, what does that mean? So we know exactly we're talking about this question. And so on and so forth. A lot of this information is very much the same from ROMEO. I think ROMEO right now basically asks you to, I think, put it all in the same, to indicate all these numbers in the same text boxes, which is really confusing. So what we've done here is we've broken it up. And one last thing that I want to mention. You'll notice here that we are asking for the first question, for example, the total number of participants or records. As you recall, as all we know, one record equals one person. So we've tried to keep the wording very broad to include both participants and records. Because sometimes people, I mean, I know everybody in this call does, but sometimes people don't really view records as people, and each record is a person. So we want all that information. All right, I think that's all I really wanted to show you. That gives you a good overview of the study, of Infonetica, what it can do, how it's laid out, and yeah, I guess that's it for me.